This is Samuel Simwanza. He has been a pharmacist for more than 6 years. A pharmacist or pharmacy attendant must follow the medications management cycle, which is comprised of selection, procurement, distribution, and use of medications. When doing this, it is important that he follows the policies and procedures that have been put in place. Samuel makes sure that he orders enough medication to avoid shortages and avoid excess stock. He also keeps detailed records of medication orders, payments to suppliers, medication disbursements, and patient payments. Samuel is responsible for the medication inventory and held accountable for any discrepancy in the medication supply. Therefore, only he and the director has access to the room where the inventory is stored. The room is kept locked and secured at all times. Keeping the room locked means Samuel can carefully monitor the stock of medications and help prevent theft or loss.
As you can see, everything is labeled, from our antiretrovirus to our radiology equipment to our anti-malarials and everything. This room is basically temperature controlled. We have to keep all the medication at a particular temperature, ranging from 16 degrees to 30 degrees for all the medications in this room.
It is important that your medication storage room is secure, well kept, and organized in the way that works best for your facility. There should be good lighting, clean conditions, shelf space, and an adequate temperature control. Here, the medication is arranged in alphabetical order and by dosage, going from left to right and the top shelf to the bottom shelf. You don't want to store medicines in a place that is too warm, where pests can get in, or where the packaging of the medications can get damaged or wet. Some medications, like vaccines, must be kept in a refrigerator with temperature controls. Medication information such as patient name, name of medication, dosage, route, time, and the patient education provided is all tracked using a bin card or computer tracking system. When a new shipment of medicines arrives, it must immediately be inventoried. The quality, dosage, and date received must be recorded. Someone uses a computer to record this information. The expiration date of the medicines must always be checked. Shelves are restocked by putting the drugs with the furthest expiration date at the back of the shelf. This is called the rule of first in, first out, or FIFO. The most recent medications should be placed behind the old stock. Donated medications must also be checked before they are placed on the shelves. If they expired, they must be destroyed. Valid medications are inventoried and placed on the shelf according to their expiration dates. Shortages can be avoided by determining monthly consumption and calculating the amount to request when to place the order. There are many ways to determine consumption. You can compare medications in stock at the beginning of the period to the end of the period, like every 6 months. You can look at the bin card on a monthly basis and find the average over time, or you can check the pharmacy computer record and find the average. A request indicator tells you when the level of medications falls to a certain number and you need to reorder. Each medication has a different request indicator, which is tracked and reviewed once a month to ensure there aren't any shortages. Educating and counseling a patient is a critical part of the pharmacist's job. Giving a patient incorrect medication can make them sick or prevent them from getting well. It is important that patients use their medications correctly. They may not always understand what the doctor has said, so it is the responsibility of the pharmacist or attendant to review the details of this information with the patient and explain what the medication is, the dosage, when to take it, and possible side effects. Sometimes it's a good idea to ask the patient to repeat back what has been shared, and pharmacists should always allow the patient to ask questions. Medication management policies and procedures will guide a facility to accurately track medication use and payment, order medicines in advance to prevent shortages, avoid the use of expired medications, and eliminate thefts. A well-operated pharmacy ensures that patients will have the medications they need when they need them, will generate trust in the health facility by the community, and will increase utilization of services.